Heart disease is the #1 cause of death for women in the United States. Death rates due to heart disease are now increasing in this country, fastest among young women. Female heart patients are 55% more likely to experience a delay in getting to the hospital.
Heart disease is the #1 cause of death for women in this country, and most of what we know about heart disease has come from studies on men designed by men, which has greatly benefited men, but women have not fared as well. Today, only 35% of the participants in research trials are women, and only 31% of the trials report the data by gender. A woman having a heart attack today will wait longer before presenting to the emergency room. She'll be less likely to have the classic symptom of chest pain. She'll be less likely to have a diagnostic electrocardiogram or blood test. Not surprisingly, she'll be less likely to be diagnosed correctly. But even if she is diagnosed correctly, she'll be less likely to receive all the life-saving therapies we have to treat heart attacks today. Awareness has decreased from 65% in 2009 to 44% in 2019. And awareness is the lowest among young women, where awareness would actually make the greatest impact. So women are not aware that they're at risk. And even women who believe that they're having a heart attack are much more likely to wait with their symptoms. They kind of take a wait and see approach. So on all these levels, we're a little bit behind when we're trying to save women from heart attacks.
Broken heart syndrome or stress cardiomyopathy, or as the Japanese have described, Takotsubo cardiomyopathy, is a syndrome where people present with symptoms that are identical to having a heart attack, but are related to an intense emotional or physical stress. It's felt that there's an intense surge of the catecholamines, the fright and flight type hormones that the body can secrete that has a shock or an impact on the heart function.
Women's heart disease remains under-researched, underdiagnosed, undertreated, and under-discussed. All contribute to the fact that once a woman is diagnosed with heart disease, she will do worse and be more likely to die from it.
Heart attacks in women are more difficult to diagnose for many reasons. One is that only 40% of women having heart attacks will have chest pain, and most doctors and patients think about heart attacks as having chest pain. In fact, we put chest pain clinics up all across the country.
But people can present with burning. They can present with feeling just nauseous, thinking they're having a stomach ache or so. People can present with fatigue.
Women are more likely to present with other symptoms, such like jaw, throat, back pain. What we want them to understand is heart disease is their biggest health threat. So if you think there's something not right with you, think about your heart. Get it checked out. If you think you're having a heart attack, don't wait. Call 911. Get to the emergency room.
I was having not so much chest pain, but I knew there was a problem. I went to 3 different doctors, and they all dismissed it that my father had just passed, and I was sad and had remorse. But I would explain to them that at some points I felt like it was a localized pain, and I would describe it like a tiddlywink being pushed back. In my mind, having a heart attack was having pain shoot down your left arm, which I did not experience. Women show heart attacks in very different ways. She told me to leave, that I was fine. My EKG was all wonky. I refused to leave. I put up my left hand and I said, "This is my white flag. It's my heart. I know it's my heart. You have to find it." She gave me another sonogram, and under the sonogram, I had this heart attack.
There are great medications out there. This is something that's preventable and very readily treatable in terms of cholesterol lowering, in terms of hypertension medications, diabetic medicines, newer medicines for weight reduction and such. So I think that it's something that we need to identify, that people need to be knowledgeable about. I feel very fortunate to be able to play that role.
With proper awareness and research, we can prevent heart disease and save lives. From reducing stress to sleep hygiene, preventing heart disease starts with maintaining a healthy lifestyle.
80% of this is preventable, so that's the great news. Know your numbers. Get your blood pressure checked, get your lipids checked, get your sugar levels checked. Be physically active, stop smoking, get a good night's sleep, and practice stress reduction.
We don't always think of stress as causing disease, but stress leads to some poor choices in life. But there's definitely, we feel, a mind-body connection, and stress does impact on bodily function, and it affects different hormones such as cortisol, and lead to progression in underlying arteriosclerosis as well.
The cardiologists at New York Cardiology Associates are working to educate not only the public, but their fellow doctors on the increasing threat of heart disease in this country, especially in younger adults, and what we can do to combat it.
It's tremendously important to reach out to other doctors when it comes to female heart disease, because we actually did a survey of cardiologists and non-cardiologists, and both felt that they were not equipped enough to treat a woman with heart disease.
I think if you feel like there's something wrong, you need to talk about it. I wouldn't be sitting here today, I wouldn't be alive if I hadn't said, I'm refusing to leave your office. You have to look into this. I know there's something wrong with my heart. You have to find it. We are our best advocates. And I love doctors. They've studied so hard, they've given up so much time for us to help us, but we have to help them also understand what we're going through.
For more information, go to www.newyorkcardiologyassociates.com.